My last question for today is for Dr. Hennessy is how should kids approach conversations with their parents when their thoughts about getting the vaccine are a little different?
I love this question. It's a really important question because unfortunately, from my perspective as a physician, it's not straightforward in everybody's mind to get vaccinated. And there's a lot of reasons for that. And misinformation, I think, is the biggest one. And, kids may be in a position, and I say kids, I should say teenagers, or maybe in a position to have more information than their parents, or at least better information. And so I would encourage teenagers to one, remember it's not an argument. So this is not something to go and debate or argue with their parents about, but rather to express how important it is to you as an individual to be vaccinated for your physical health, your emotional health, and for the health of society around you. Use sources that your parents respect. Your local hospital, GBMC, if that's where you get your healthcare, or big name university research hospitals like Johns Hopkins or Mayo Clinic. Use resources from those institutions. Use news sources that your parents trust, because there's probably not a lot of real news sources out there that are saying don't get vaccinated, and have those references handy. I also recommend that you find an adult, preferably a family member, you could have that conversation. So it's a three-way conversation to help, advocate for you. And lastly, you can always ask your parents, say, I'd like to get this, and I know you're skeptical, so can we make an appointment with my family doctor or my pediatric provider, and so we can all have a conversation and determine what's best for me. And that way, the doctor that's taking care of you growing up can help you communicate to your parents how important this is to getting life back to normal in a safe way. And, again, the whole time, no argument. This is just a discussion, and you're much more likely to get your parents to be on your side about it.